So typically, when I'm looking at doing a procedure, I'll put like a band on your head so I'm able to expose your whole face, and it'll, like a sweatband type of thing, and it'll expose your whole face there. And so when I give a treatment, I'm going to want to do an ablative type laser, say since we're going to do that. And in this case, we'd be using this particular product right here. It's a pixel laser. And so the idea is to get right against the skin, and we basically press the button and it blasts, and it kind of does it every like split second, or you do multiple blasts at one time. And you kind of go in a straight line pattern, go back, do it again, go to the next level, do it again. And the idea is to eventually get around the whole face and do that whole ablative treatment you're looking for. And then what will happen is that your face will get red over the next several minutes, and then the next several days will be red, and you'll start to peel about 3 to 5 days later. And that'll probably go on for about 7 to 8 days. But you're going to have all new brand new skin. It's going to be shiny, glowy. The idea is to keep your skin full of moisturizers and lots of emollients while it's trying to recuperate and regenerate and try to keep itself healthy. So you need a lot of fluids, okay, so that you can lock in the moisture by using those emollient creams and stuff. So that would be the idea with using laser, okay? And then on a following visit, when you come in, you have all this nice shiny new skin. We're going to focus in on the lines we talked about. So right here, when we look at the scowl lines, we'll call them, okay? These are created by the corrugator supercilii muscles on each side, and then you got procerus muscle down here in the middle, which kind of makes the bunny lines here. Okay, so what we want to do is want to basically inject here, and maybe a spot up here. I usually have you contract and scowl for me, right? So they were able to get the bellies of the muscle relaxed now. And so we inject like maybe here, here, and then come over here and next to the other belly muscle here. And this will stop you from being able to contract medially. And you do the same thing for both sides, here, here, and here. And that scowl line should improve. Now, the bunny lines here is a different muscle, so you'll probably have to inject this separately as well. And that will cause relaxation there. Sometimes when people get those squinting lines along the nose, the real bunny lines, you have to inject those too. You don't have those, okay, which is not a bad thing or a good thing. It's just a matter that you don't have it. You have to worry about that one. Then, and if you want to get the frontal lines, okay, from the forehead, then that's a separate treatment. So you kind of, depending how you want to deliver it, you can go into the bellies of the muscle. That's where you want to do it. Inject into the bellies of the muscle, not the lowest line ever, because that can cause dropping in the forehead. So you want to go to the next line up, in the belly, and kind of start spreading out here. And unless you want to do this weird thing like that, then you want to put a little bit up here, probably, a little bit up here, so it drops basically the end of the eyebrows down just a little bit, so it doesn't stick up randomly like that. Now some people like a brow lift, and in that case, you come up here and you kind of give your pattern of injection, you go to the sides like a little bit, and you stay away from the line, so it will give them a little bit of brow lift, because all this would be essentially paralyzed and weaker, but up here the frontalis muscle is still strong, so it pulls a little bit here on the side, and then you can come over here and give a little bit of injection here, so it drops the orbicularis oculi muscles, opens the eye a little bit here, and then you get a little bit of pull back here, so you get a little bit of a brow lift by doing a toxin that way. So there's ways of accentuating features in your face, which is focusing on where you want to put the injection. So that's would be the idea of that. And if you get these little crow's feet lines you talk about, you inject these separately. You get underneath the eye here too, underneath the eye here too, so you can't squint so much and get the constriction and get the lines underneath the eye. So that would be the idea of doing that part of your face. When people talk to me about what about down here, the lower part of my face, toxins are not made to be used in the lower part of your face except certain parts. So you focus right here where the pre-jaw lines are. You inject here so you don't have a reverse smile. So you can pull it up a little bit. That makes sense. You inject here and here, and that stops pulling down, and then you can kind of relax, and it comes up a little bit. Make sense? I mean, those are the places you want to focus your toxin treatments. They're not made really for going other places. Some people have this little line, little chin line where it comes up a little bit. You know what I'm talking about? You can put a little toxin there too to relax it so it drops down a little bit so it doesn't have that wriggle effect going upwards. You don't see those as often, but they are present in people, and they want to get rid of those. Sometimes, and then let me talk to you about the filler, because after you come back, A month later, turns out you still have these scowl lines that are still present, and they're still there, doc, and I can't scowl anymore, but I still see some lines. So in that case, we can use a very fine type of filler, a collagen or hyaluronic acid filler, and inject underneath in the dermis, right here and here, and to make these lines much finer, if not disappear. Okay? The ones on your forehead are going to disappear, okay, because they're not as deep. But these right here, because they're deeper, you'd have to fill them in. Okay? The other thing I would talk about doing is maybe coming in here and what we talk about the tear troughs, which is right here. And then, you know, gravity pulls down on our facial tissues, and over time, it's not that you're losing, you know, you're getting periorbital fat, it's just that you're losing the soft tissues because of gravity. So you fill underneath right at the base of the bone, you inject, and you basically pull the tissue up. And so then it makes a fill here. And then if you want to accentuate and make the cheeks a little bigger, make the cheeks a little bigger. So it pulls it up a little bit. And then nasal labial folds are separate treatments. You inject subcutaneously there into the dermis. You can inject a little bit deep there to give a little more deeper volume, and you provide that. And then maybe you come down here, and where the pre-jaw lines are here, you can inject here to get, so you get the little pieces that make you look a little gaunt right here. You fill those in so they're now full and accentuates the jawline. And then you can even come in here and go underneath here and inject underneath where the smile reverses there and do that. So there's a lot of stuff you do, you just don't want to do it all at the same time. And I think the treatment can change as we go along, because this is what I think we're going to do, but I don't know what it's going to look like in, in a few weeks after we do the ablation. Maybe things look a little different, so we don't have to do as much of this, or we have to do just a little bit different because things just look a little different. And the same thing also with the toxin. But in general, that would be an approach, to figuring out what we'd like to do for you. And then if you told me, well, doc, you don't really have very many, but I don't like all these sun damaged spots I have here, so I want to get rid of those. And so in that case, we did a laser treatment. We just change and put on our pigmentation head too, which it goes a little bit deeper into the dermis to basically get the pigmentation out. And so that can help. But those pigmentations will come back if you're in the sun. So you have to protect yourself against that occurring again. So that's basically an idea of things you can do. But since you're right there, we have this other treatment we do for people who are losing their hair, where we do this platelet-rich. How I told you we platelet-rich plasma, we do plasmaless?
Yeah.
Well, the growth factors can be used for just about anything. And we can actually inject them in your face, to get filling here and new tissue and all this stuff. So instead of just sticking fillers in there, some people use some fillers, but platelet-rich proteins also and growth factors. So you use that PRP, as we say, and put it in your face. But you can also put it in your scalp. If you're getting a receding hairline, losing your hair, you can inject it in your scalp to get the hair growth to come back too. So there's a lot of different stuff you can do with that. Now you have the fluid over there, sterile fluid, that once we take your blood, we spin it in the centrifuge, and then we separate out the fluid in the sterile chamber so we can take those products out and separate them and concentrate them. And then we photolight activate them so we get the platelets to open up or release their growth factors, and that's when we want to take them and inject them back in.
Wow.
So that would be an idea for that, whether it's in your face, in your scalp, or any other damaged tissue. I've had patients present with a facial abscess, which is the worst thing you want to have, because you've opened that, you can have a big scar there, right? So in some cases, I've taken a platelet-rich plasma, and I've spun it and concentrated, and I injected directly into the little abscess on their face, all places around it, and I've had these things clear up in 3 days, gone.
Wow. I have a friend. I need to send her your way.
So it's an idea.
Yeah.
Right? You can get some significant improvement in healing, and obviously avoid any further scarring on your face, or you don't want to have any type of huge blemishes on your face. So that was a remarkable outcome.
Yeah, I a few years back went to a dermatologist that just decided to remove just a little sebaceous and left a scar on my face. And most people don't notice it, but on HD TV, it looks like the Grand Canyon.
For you, you noticed it the very day they did it. And you noticed it every day after that, right?
Yeah.
So even if you're going to touch somebody's face, that's the most important feature on somebody, right? So you obviously want to be conscious of whatever you're going to do to them. And tell them, well, this is what's going to happen. We should explore different options. Because one would argue that, well, that's a cosmetic procedure. Well, I still think you should offer it to the patient, right? because if it's going to bother them later, might as well talk to them about it now.
Yeah, I talked to a plastic surgeon about it, and he said he shouldn't have done that. I guess even with face peels, that's never going to go away. It's always going to have a slight.
No, probably what you'd probably do is fill it with a filler.
Mm-hmm.
You just put a little filler subcutaneous, and you'd have to fill it frequently. But over time, you put fillers, hyaluronic acid fillers, they'll stimulate your own collagen and elastin growth too. So it's going to get a little thicker anyway. So you may have to do it less often.
Oh.
But you can do that. So if you've had patients that, come in, sometimes they have acne scarring, so they have pitting. So you can smooth that as much as you want to using a laser and a derm needle or a microabrasion, stuff like that. It's going to polish it, but it's not going to make those holes go away.
Right.
So you're still going to have to do some filler in there to help improve that appearance. You ain't going to make it look perfect, but you're going to get some improvement in it. It's going to look a lot better. But I think that you have to offer those things, or at least be able to have something in your repertoire of things you can do. You can offer the patient, or at least know where to send them so they can get that treatment available.
Yeah.
When I use products, I go with whatever the patient
Okay.
wants me to use. I have a lot of different products, and a lot of them are good for different things. And so it just depends what they've heard and what they're looking for. I don't know any company, any specific revenue for mentioning their products.
Mm-hmm.
So I will use, a lot of products are very good and very similar. And so I just think it's whatever patient they tell me they like to use. I have some favorites, yes, but I think it always depends on the patient, and I think that depending what kind of smooth appearance we're looking for, they may have a preference. And so I'm always open to different products, but I carry various different products in terms of toxins, in terms of fillers, because you just want to have a different amount, because different patients come from different places and they've always used a certain product, maybe they've been exposed to, and they want those. So you just have different ones.
Okay.
But I'm not sold to any specific company. I try not to mention or reference any company because I feel like you're giving them some free advertising when there's a lot of products out there that are just as good.
Well, thank you, Dr. Allende. This has been most interesting, and it's given me a lot to think about.
It's my pleasure. Enjoyed having you as a model.
Well, great. And I'll be back.
Looking forward to it.
All right. Thank you again.
Thank you.